Hello, welcome everyone. Welcome to MedCity News's Invest Digital Health Conference. I'm going to go ahead and start with sharing a little information about MedCity News. So my name is Orundhati Parmar. I'm the editor-in-chief of MedCity News. The company was founded in late 2008 to cover innovation in healthcare. We are a national publication drawing nearly 2 million page views and 500,000 unique page views per month. We cover biopharma, digital health, diagnostics, medical devices, as well as hospitals and payers in the context of the industry's overall transformation. And of course, we're covering COVID-19 very closely. We also host conferences focusing on investment, population health, precision medicine, digital health, and patient engagement. MedCity News is very open to accepting contributed content, so you can always email me to provide information on whoever would like to write for us. We have a new program called Med Citizens. It's a membership-based program for startups with editorial and event benefits. And the person leading that is Stephanie Baum, and her email will be placed in the chat so that if anyone's interested to join that program, you can do so. We also hosted actually launched our podcast called MedCity Pivot Podcast during the pandemic. And we've had very interesting speakers, including Zeke Emanuel, be a guest on the show. So if there's any person out there that you feel has something important to say or even entertaining to say, please email me with suggestions for the MedCity Pivot Podcast. A big thank you to all our sponsors, Fredrickson and Byron, Unity Point Health Ventures, and Deloitte, without whom this event would not be possible. And of course, a big thank you to our partner, Medical Alley Association, which is an industry association dedicated to highlighting and supporting innovation in healthcare in the state of Minnesota. They have been partners with us for the past 3 years. 2 conferences have been in person, and of course, this one is virtual. So a big thank you again to Medical Alley and everyone there. So today we're tackling a real major issue, something that has become even more prominent with the COVID-19 pandemic and the ensuing loneliness. So we're tackling how the whole loneliness and behavioral health epidemic. We have a really stellar panel. Dan Gebremedhin from Flair Capital, Sarah Donnelly from Quartet Health, Samantha Hanson from North Memorial Health, and Dr. Monika Roots from Sanvello. I will introduce each of them. So Sarah Donnelly is the Chief Product Officer at Quartet Health. She brings with her over 10 years of experience in health technology development. Quartet Health connects people to the right care at the right time. The platform brings together physicians, mental health providers, and insurance companies to effectively improve patients' health and drive down healthcare costs. Sarah's career began with an electronic medical record focus for major health systems in the US and UK. Most recently, Sarah consulted with a focus on integrating disparate technical solutions with a strong user-focused methodology. She joined Quartet inspired by the mission and motivated to ensure Quartet's position as a key partner to all patients and providers in the mental health landscape. Welcome, Sarah. Next, we have Samantha Hanson, who is the Chief Administrative Officer of Northwell Memorial Health. Samantha Hanson joined North Memorial Health in 2017 as Chief Administrative Officer. Hanson leads shared services teams to ensure integration and optimization of these functions in service of team member and customer experiences throughout the system. She oversees IT, human resources, marketing and business development, customer experience, and medical affairs. North Memorial Health is a 353-bed community hospital located in Robbinsdale, Minnesota. Prior to joining North Memorial, Hanson served as Chief Human Resources Officer at Children's Minnesota. Welcome, Samantha. Next, we have Dr. Monika Roots, who is the Chief Medical Officer for Sanvello. Dr. Roots practiced as a child, adolescent, and adult psychiatrist. She was also a clinical adjunct assistant professor at University of Wisconsin-Madison and was most recently the Vice President of Health Services and Behavioral Health for Teladoc Health. In 2016, Teladoc Health acquired her business, and of course, as we know, Teladoc is now been Excuse me, I'm thinking of something else. I apologize. In 2016, Teladoc Health acquired her business, CogCubed, a behavioral health analytics company. Dr. Roots earned her MD from University of St. Eustatius School of Medicine and completed psychiatry residency and fellowship in child adolescent psychiatry at the University of Minnesota. Welcome, Dr. Roots. And last but not least is our moderator, Dan Gebremedhin. He's a partner at Flair Capital. Dan also serves on Massachusetts Governor Charlie Baker's Board of Nursing Home Administrators. Dan was a practicing internal medicine physician at the Massachusetts General Hospital and had a faculty appointment as an instructor in medicine at Harvard Medical School from 2010 until 2019. Prior to joining Flair, Dan served as the medical director at Harvard Pilgrim Health Plan. He earned a BS with honors from the University of California, San Diego, and an MD summa cum laude from the Morehouse School of Medicine, and an MBA from the Harvard Business School. Dan completed his internal medicine residency at the Massachusetts General Hospital. Welcome, Dan. So I will stop sharing right now and turn the microphone over to Dan, who will conduct the panel. And then 40 minutes into our conversation, we'll open up the question and A to the audience, and then I will conduct that. So Dan, please take it away.
Thank you so much, Arundhati. Really appreciate the time and the opportunity to discuss this important topic. We're here to talk about, kind of behavioral health challenges and social isolation, specifically in the context of the pandemic, but these are not new issues. We've long had a behavioral health crisis with provider and clinician shortages across the country, long wait times for access to world-class behavioral health care. Social isolation has been a long-standing challenge, primarily for adults. 1/3 of all adults over the age of 45 have described themselves as lonely. 1/4 of older adults over the age of 65 are considered to be socially isolated and have shown increased risk of premature death from all causes that actually rivals that of smoking and obesity, along with a 50% increased risk of dementia. Enter the pandemic and the challenges that we have both from a societal perspective, but then also from an isolation perspective. We've noted threefold increases in depression and anxiety. We've noted double-digit increases in suicidal ideation and attempts. So, again, these were crises before the pandemic, and now with the pandemic, it really has reached a fever pitch, and we really need to all come together to bring, as many great solutions as possible. And so I'm excited to lead this conversation with great representatives from the large provider community, as well as from rapidly growing health tech companies. So I'd like to kick it over to our panel. Maybe we'll start with you, Monika. Maybe introduce your organization, Sanvello, and talk a little bit about how your organization has responded to the pandemic.
Thanks so much, Dan. So I'm the Chief Medical Officer of Sanvello. We are a virtual care company that has self-care, coaching, teletherapy, and telepsychiatry services. We serve a wide array of population, and our self-care app is actually available globally. As we have looked at this epidemic, as you've talked about, we have really seen that isolation has become an issue. And I want to make sure that we differentiate that from solitude. Sometimes being alone and, checking in with yourself is okay. That's a moment of solitude. That's actually an area of strength. But loneliness is where you feel like you are not being heard or connecting with other people. And so at Sanvello, we've done many things. As we have seen the increased need, many more people are signing up for our services. And so we've done everything from increasing our coaching experience so that everybody has access to that, creating communities so people can come together and actually support each other. For example, we started a community called Staying Socially Connected, and individuals from over 185 countries came together to support each other. And so I think as we think about tackling this pandemic of loneliness, which only has the potential to worsen, we need to create these scalable solutions to help address it.
Thank you so much, Monika. I might transition to Sarah. If you could kind of introduce yourself, introduce your organization, Quartet, and then talk a little bit about how you have been responding to the pandemic.
Sure. Hi, everybody. My name is Sarah Donnelly, and I'm the Chief Product Officer at Quartet. Quartet is a company that provides services and technology to connect patients to mental health care. So we work with payers, and then we try to find patients a carrier that meets their preferences, matches their insurance, and is local to them. Since the pandemic started, we really had to sort of shuffle our product around and also our services to meet the changing environment. Before the pandemic, we definitely saw a few teleproviders on our platform, but not very many. Since May, we've had over 80% of our appointments scheduled for teleproviders. So what we did was really kind of try to adjust our technology to be able to understand who was offering tele, and then match patients to tele and try to give them more information about it. For a lot of patients and providers, this was their first experience with digital care. And it's a little scary, a little unknown. And so we really tried to offer our patients tools to help them understand what to expect. And also try to offer our providers those same tools so that they were prepared to take on a new element of their business. So it's been very exciting, very, very different. But change happens sometimes quite quickly, and not often is that the case in healthcare, but this year it is. So it's actually very exciting.
Thank you, Sarah. Really appreciate that. Samantha, if you could introduce yourself and your organization, North Memorial Health, and talk a little bit about how you guys have been responding to the pandemic.
Yes, thank you, and thank you for the opportunity. I'm Samantha Hanson, Chief Administrative Officer of North Memorial Health. We are a multi-hospital, multi-clinic, and surgery center organization. We also have the largest air and ground ambulance services in the upper Midwest, in Minnesota, and Western Wisconsin. So we are facing this challenge on many fronts. Of course, the people who depend on our system for care, addressing the connectivity both to healthcare, but then also the fear component of receiving care and coming in and receiving those services. The adoption of telehealth as an access point, both for patients as well as our providers, but also for our workforce. We have 6,400 team members across this geographic area who very quickly had an opportunity to rise to the challenge, and they did so. But they were separated. We had a quarter of those individuals who were very quickly sent to remote work, which for many people potentially attending this conference would say, well, that's not a big deal. Many of us have been working remote for a long time. But I can tell you in the direct provider world, that was a new behavior. So we were equipping them with the technology, the tools, and the support to be separated from their coworkers and their workplace. While the other 3/4 of our workplace was delivering frontline care in the face of rapidly changing information about what it was to handle the pandemic, address COVID, and then rapidly shift our care models accordingly. Like many health systems, including the mental health providers in our health system, the use of telehealth and technology to reach those customers has really been, I think, as both Sarah and Monika reflected, a very rapid adoption and a way to reach. However, such a valuable conversation for today as we think broadly of bridging on a longer term basis that gap that faces all of us in connection, addressing our exacerbating underlying conditions of mental health, depression, anxiety, etc. And then also the impact that it has on our workforces and most notably for those delivering care. So I look forward to participating today. Thank you.
Yeah, no, thank you so much, Samantha. I mean, we're all extremely grateful and indebted for the important work that you and your colleagues, healthcare workers, are doing on the front lines of the pandemic. So really, really appreciate that. Maybe starting our conversation, Monika, I might start with you. Loneliness is a feeling, it's a sentiment, it's an emotion, but we're talking about it in the healthcare context. Is loneliness a healthcare issue?
We know that it's definitely affecting one's health, but I think it's a much larger problem. It's almost a societal problem and an educational problem, meaning that people are not inherently always aware that they're lonely. And so actually defining that, I think, is an important thing. And then also trying to decrease the stigma around loneliness. Many people will say that they're lonely and they think that that's sharing a weakness, but in some ways that's a strength. And so if we think about educating our younger generation, even our older generation, I think that is potentially starting to address the issue of loneliness. And I think that our younger generations have been showing us what that progress looks like, and that they have been much more willing to come forward and say, I have a mental health concern, or please help me support my mental health. They have shown us that that change in a generation and changing the way that they think has created an ability to ask for help and not seeing it as a weakness. And so if we can start to use those terms and those concepts at addressing loneliness, I think that we can start to change that in the fabric of our society.
It's really great context, Monika, and thinking about, how do we define, the issue of loneliness. We'll begin to, understand how we help treat it. And so maybe Samantha, when we think about the solution, for loneliness, is it going to be a healthcare solution? Is it a societal or educational solution, as Monika suggested? What are your thoughts on, how do we begin to tackle the loneliness epidemic?
I think it's a yes, because a true adoption of intervention, awareness, the courage to discuss one's loneliness really needs to have the support on all fronts. From a workforce perspective, do you have leader training that allows people to check in on well-being and have that not be seen as an additive, or if you have time, or even worse yet, not a productive use of time? You can absolutely shift our mindset around loneliness. Two, I think in a community, the reminders to encourage people that you're not alone, that chances are, if you will reach out, you're probably reaching somebody else who is sharing similar feelings. And how do we use our community organizations, events like this, and as we are moving more virtually, making sure that we're intentional on that wellness and check-in. And then thirdly, accelerating the access and awareness of tools, making it easy, making it available, advertising, using social media, destigmatizing the fact that dealing with the pandemic, loneliness and intentional and purposeful connections are just as important as masking, social distancing, and hand hygiene, for example.
No, really great insights. I definitely hear what you're talking about in terms of just, being aware that it's an issue and being open and honest about it is the first step to asking for help and asking for, assistance in moving forward. As we start to think about making these attempts at intervening on loneliness, how do we know if we're being effective? Sarah, I know you guys have spent some time thinking about how do you think about ROI and loneliness? How do you think about impacting loneliness, and how do you actually get the benefit?
Oh, yeah. So, loneliness can be present in people with mental health conditions and those without mental health conditions. It can exacerbate things that are underlying going on, or it can just be something you're experiencing for the first time. I think as employers, we have to invest in that, understanding where people are, if they're, especially right now, if they're alone, are they with family, do they have connection? And the ROI there is certainly measurable in terms of productivity. People's engagement in their job and happiness in their life is directly correlated to the product of work that they are able to produce. So it's pretty good from an employer standpoint to make sure that your employees are well taken care of and feeling okay. And from a mental health standpoint, the ROI is also quite clear. So the more that we get people into a healthy mental feeling connection, they're feeling valued, their conditions are controlled, the lower their overall cost will be to the healthcare system. So less frequent visits to the emergency room, less potentially less prescription need, et cetera. So you can really approach the ROI from a number of angles, and it's there every which way you look at it. So not only being, a great reason to save money and be more productive, but it's also a great thing to do for your people.
Yeah, no, that's a lot of really great points, Sarah. And I might do a follow-up question. In our prep call, we talked a little bit about each of your own organizations, how you're actually helping your own employees not be as isolated and giving them prompts. Maybe if you could share a few anecdotes there.
Yeah, sure. So Quartet primarily was an in-person organization with some remote employees, but a large portion of our workforce was in person in New York City. And we really had a strong culture of collaboration and spending time together, both working on our important mission, but also outside of work. So when we went virtual, it was a big priority for the organization to try to foster some of that sense of team bondingness, I guess is what you want to say, and collaboration with each other, even though we are remote. So we tackled that a couple of ways. One, we trained our managers on how to have those conversations with their employees, signs of burnout, what to look for in those conversations to try to pick up if your employee is struggling, because it's not a skill that everybody has to be able to pick that out. So that's how we kind of handle it from the people side. And then from giving the teams power to create connection, we gave each team a budget and a list of suggested virtual activities that they could do with their teams. And so some people did, remote coffee tastings, or they started book clubs, and just try to find other ways to connect based around common interests. So it's been really interesting and fun to see some of the remote games we play as a company are very interesting. There's fact games and all sorts of fun stuff.
Yeah, no, I mean, there's been no shortage of virtual happy hours and offshoots of that. Samantha, I know you talked a little bit about some activities that your organization is participating in to try and reduce social isolation.
Yes, and part of it is both using the technology, Zoom, Microsoft Teams, most obviously, but then also finding those chances where we can come together in smaller groups and do that safely. Keep in mind, a large portion of our population never went home, so they are working in a very different type of an environment, managing the protective behaviors that we've talked about. But finding those ways to build those connections, very similar to what you just heard of asking and giving our leaders permission and skills to connect in a different way. I think that it is, we also started looking for different tools and had had games where we were trying out different wellness tools and different apps and sharing that information with the key premise of it's okay. It's okay to have this conversation. It's okay to ask for connections. And it's also okay to use the tools that we have available, whether and what fits for you. We were working with Blue Cross Blue Shield Minnesota, who is our benefits partner, but also our business partner with a joint venture, and developing tools with them that not only they could use with North Memorial Health, but then also with their larger portfolio of employers as well. I think if I could just quickly add on the ROI, it's important to note that the getting preventative health care and obviously encouraging people to go get care is impacted by one's sense of loneliness and isolation. And that has additive costs for employers providing benefits as well as to us as a community. So HR departments working with your workforce, encouraging those preventative health and having fun fun campaigns to help encourage people to take care of themselves and go receive those preventative services that perhaps we all might have been putting off a little bit in the last 6 months.
Yeah, no, Samantha, it really is an excellent point. There's been so much focus on the death rate from coronavirus that there's been a hidden crisis. Rates of death in the home outside of large care facilities due to chronic conditions such as congestive heart failure, stroke, have been increasing dramatically. And it's something that people are not talking about, right? And as you described, there is a fear, right? There's a fear of getting care because of coronavirus, which leads to social isolation, which leads to further fear, suspicious cycle. So really, really important point. Thank you for bringing that up. Monika, want to talk a little bit about, the work that you're doing at Sanvello. You had mentioned that you have, a group-like experience on the platform. I think you guys have seen significant increases in uptake and utilization. Maybe talk a little bit about what you're learning from the community, and then also, you have a very consumer-directed experience, right? Which is a little bit different than, say, an academic medical center, which again, of course, evidence-based, but may not have the consumer experience in mind. If you could talk a little bit about those points, that would be super helpful.
Absolutely. So we have over 3.5 million users now. And I think that really attests to the fact that we look at the experience as being the foundation of our medicine in a way. We think of ourselves as almost like a gummy vitamin. You still get the nutrition and the benefits from it, but it doesn't have to taste bad, right? So for us, we have created multiple opportunities for people to be able to better themselves. So that might include improving their mental well-being, but also maybe improving their anxiety, depression, and other stressors. So for us, we've created self-care opportunities, community settings, which are almost like bulletin boards where people can message each other with similar interests or similar stressors. For example, we have a community group for frontline workers, or hospitality groups, or parents with kids with special needs. They all come together and really support each other. On top of that, we have coaching and group coaching, which is a way of bringing together with a moderator an ability to have a almost group class on a technique that might help a person with anxiety. But I think for us, community is not just something that we bring for our users, but has also been something that we have fostered from the beginning of Sanvello. We have always been a virtual company. And so I think that has really helped us with this change and pandemic where many people are going home. So what we've done is we support all of our providers, meaning that, especially right now with the acuity being higher, the risk of burnout for teletherapists, but really any healthcare provider, has really gone up, and we acknowledge that. And really now the barrier between work and home has really gone away, and so that boundary is gone. So we have really tried to encourage boundaries. We have also given time during the workday for self-care. So small groups can come in and just talk about how are they doing? How's your burnout? Are you having difficulty with the fires in California? Or how is COVID affecting your community? We want to hear how they are doing so we can help them. But in addition to that, we've done fun things. So we've done everything from the virtual happy hours that you talked to, having some time of find your happy place, and everyone brings in their videos and shares it with everyone. What we're trying to do is make sure that they understand they're not just employees, but they are our community, and we want to be able to share that. And I think as we look forward to how we're going to continue to get through these difficult times, I think we need to continue to encourage boundaries, but still offer these opportunities for community to bring people together.
Really, really great points and great examples, Monika. I love gummy vitamins, so I really appreciate that analogy. I've been actually using a lot of gummy melatonin during the pandemic. I might kick it back to you. In our prep call, we had this really, really great discussion about the stigma associated with loneliness and the language that we use, not only to describe loneliness, but then how we've been managing the pandemic, in terms of the concept of being socially distant. I mean, can you expand on that and how you think about, the power and the negative energy associated with stigma around loneliness?
When people say, hey, I'm lonely, they think that they are saying I'm weak. People don't like me, or I don't have enough people to share my time with, and so therefore I'm less than. that's kind of, I think, the mindset of people who express that they're lonely. And we need to be very careful that we don't think that loneliness is solitude. Solitude is where you're very comfortable with yourself. Maybe it's a time for introspection. It is actually a pretty powerful mindset. And so I think what we need to do is understand that loneliness is fostered by lifestyle, by circumstances, right? So as we think, for example, of all these Zoom calls that we may be having, we're seeing people all the time, but that doesn't necessarily mean that you're having in-depth, fruitful conversations where people are really understanding how you're doing as a human being. And so as we start to take that away and say, hey, loneliness just means we need to give you more opportunities to have meaningful, deep conversations or time for introspection, I think that really starts to shift the dynamic. But we also need to give people a little bit of a break, right? Right now it's the pandemic, so we have decision fatigue. When we go outside, do we have our mask? What am I going to find when I go outside? We have anticipatory anxiety of how are the numbers of COVID? What's going to happen next? We have political and racial tensions. We are exhausted. And so reaching out for that meaningful conversation might feel like it's too much right now. And so that's okay. Give yourself a break. But I think it's where we start to give these little opportunities for connection, like maybe some of the communities in Sanvello or other groups that you may find on Facebook or other groups. I think that that starts to give people a little bit of an opportunity to kind of dispel some of that loneliness that they're feeling.
Really, really helpful context, Monika. I think that's super important about the language we use, and then the importance of balance. Sarah, you talked a little bit about what I thought was so insightful, that oftentimes there's a quote unquote poster child of loneliness, right? The 85-year-old empty nester, is home alone, and that's who we tend to target our resources to. But there may be a broader population that has a sense of loneliness. Sarah, you might chime in there.
Yeah, definitely. I think, it's a big misconception in the world that you need to be alone to be lonely. But there can be very real feelings of loneliness, and you can be surrounded by people. People were lonely long before COVID. COVID certainly isn't helping matters, but I think the first step in combating loneliness is teaching people to be aware of it. Why am I feeling this way? I'm down. Why am I down? I haven't connected with a friend. I haven't spoken to a sibling. I'm feeling that there's this part of me people don't understand. I think even that first step of understanding what you're feeling is a skill that is really missing in the world, just generally. And that the more we talk about kind of introspection as to why am I feeling this way? What do I need in my life that I don't have? If you're in need of connection, then going to seek the connection would be step 2. But step 1 is really trying to understand what you're feeling. And of course, not for a plug here, but that's what great therapists are for, helping you understand what you're experiencing emotionally. But yeah, it's a big, big misnomer. Some of the loneliest people that I've met, my mom actually struggled with mental illness for most of her life, and she had 5 kids and she had 5 siblings, and really, really, really combated loneliness throughout her life. So I think just opening our eyes around what does loneliness look like as a society helps change it.
No, really appreciate you sharing those personal stories, and it goes to show how complex an issue like loneliness can be. That said, and I'll open this up to the whole panel, whoever wants to jump in. That said, this is a health tech invest conference, right? So there's a lot of startups, who are tuning in today and are entering the market with different apps, kind of different tech-focused solutions, some service-based solutions, trying to combat loneliness in the best way that they know how. One company is, sending grandkids on demand. Another company has computerized avatars, animal-based avatars that are, keeping seniors, quote unquote company. How do you guys interact and, react to a lot of the score of apps and the score of, kind of tech-based solutions that are coming to market trying to attack loneliness? What are your thoughts on what the solutions that we're seeing in the market?
Dan, I'll jump in and kick us off. I think from a healthcare provider and a large employer, what would be helpful is an aggregator. I think where we run into issues is when we have a perception that there is I'm going to use the term silver bullet, or one answer that's going to solve the problem. And the reality is we are all unique, beautiful, individual people. And what is impacting us at the time, whether it's workplace facing, personal, or both, is we need to know what's available to us. So there are so many wonderful tools out there and services and therapists, but it's the what do I need right now? So it's the permission to know that it's okay to ask for help, and then what kind of help do I need? That interface, oftentimes employers end up playing that relative with their EAP partners and their internal partners to bridge that gap. But I'll offer that up to the panel's consideration, and it's how do you provide the content of solutions and match that to the individual.
Samantha, I love that, because I do believe that, as you said, everyone is a snowflake, basically, right? And so there is not one single solution that's going to help everyone. But I think the biggest thing, as we're, talking to startups about ideas, I leave the idea that to really mitigate loneliness is to develop deep connections. And so that could be a deep connection to a digital pet. If that's what it takes for you, then great. But it's something that it causes a person to feel like they are heard and understood. And the only way to do that is a deep connection. And so that's really my request, right, of all these apps and solutions that are coming to market, is to please keep that in mind, because a point solution that might work for a day or two most likely will not help mitigate this loneliness that is really years and years in the making.
Really, really great insights. One of the things that we haven't really talked about is this real transformational shift to virtual that we've all had to undergo. The pandemic isn't going to last forever, right? I guess the question is, look into your crystal ball. We are living in this new normal. What do we go back to? Do we go back to full brick and mortar? Do we go back to a hybrid? Do we all stay online because it's so convenient and it's so helpful? What are your thoughts as you think about your organizations? How are you guys positioning for, assuming that a vaccine will come and, next spring, many people will be vaccinated, our vulnerable populations, will be accounted for, and people start to come back into the communities. How are you evaluating, your response to this new virtual world that we're living in?
I can jump in.
Please.
Yeah. Go ahead.
The awkwardness of Zoom, guys. So we're definitely embracing the virtual reality, but it is reality. And going forward, Quartet is definitely going to go mostly virtual. I think we're going to always have a presence in New York, as well as potentially some more cities. But we really believe that what we've seen, and I can speak from personal experience, the gains that we've made in our personal lives, people with children and people with elderly people to care for, parents are getting to spend precious time with those loved ones, not commuting. And we are seeing just as high productivity from our workforce as we did pre-COVID, and maybe even higher. So we're really excited about the trend. We think as far as the delivery of care, I expect there to be options, so I think it won't go fully back to brick and mortar. There'll be the online option for the people that works for, and for the providers that like that technology. And then there's going to be a group of patients that need and want in-person care. So I think the future is a blend.
Sarah, I absolutely agree. I think that this hybrid approach is most likely where we're going to end up, because let's face it, many of us have Zoom fatigue at this time, or just digital fatigue in general. So Sanvello, since the beginning, has always been focused, especially in our teletherapy and telepsychiatry, of full integration into primary care. And primary care will always require a brick and mortar element because of the physical exam, labs, etc., which some of it potentially we could do virtually, but we won't always be able to do that. And so I think similar to what you're sharing, Sarah, we definitely have created opportunities for not being socially distant from our own families, right? So I don't love that term socially distant. I like physically distant, right? So that we can promote healthiness. But we in some ways have lessened our social distance from our own families, loved ones, and had those opportunities. But I do think what we're going to see after this time is a hybrid approach that's very consumer driven. People are going to demand virtual because they see really the opportunities and the convenience, but yet there will definitely be those who just cannot stand another Zoom meeting, and that is fine, right? So that hybrid approach, I think, will be what we'll see.
I might add, you, Sarah and Monica, great points. It's going to be hard to put this genie back in the bottle. I think there is a level of user adoption on both providers and patients and each of us that we're not going to be able to go back from. That said, there will be a normalization. I think once we can find a way to have that combination, that hybrid combination, I envision, I know for North Memorial Health, that's what it's going to be. Unless you're in a direct care line, we're going to have a hybrid where people will be working remote and then coming together to for events or meetings, et cetera, safely. But I believe that's probably what we're going to see across our country. I am very optimistic about what technology can do to accelerate those connections between providers and patients and people in need, where the transportation and other types of barriers that have long time been impacts to receiving care in a consistent way. I think technology is going to, and already is, a wonderful enabler. And sometimes necessity drives that adoption. For those of us that have been in technology for a while, you're always trying to figure out how can you get users to adopt new technology as well. This will be the silver lining of the pandemic.
That's really, really great commentary. I guess maybe we probably have one more last question that I'll ask, and then we'll open it up to audience Q&A. We haven't really talked much about, the broader behavioral health issues that our society is struggling with. Again, the way that we tend to think about behavioral health, at our investment firm is that for the first, let's call it, kind of 10 years of this like technology innovation in behavioral health, we've been trying to solve the access problem. People can debate as to whether or not that problem is yet solved. But we haven't really been talking about outcomes. We haven't really been talking about quality. And some might argue there's actually no money in quality. There's no money in outcomes, but there's real money in access, right? We're paying for access today because we don't have enough of it. We need more of it. I don't know what folks' thoughts are on this panel. You guys are all working in and around these issues. Would love to kind of get your thoughts.
Yeah, at Sanvello, we definitely think that access is not the sole problem. There are many solutions out there. Brick and mortar providers frequently don't measure outcomes. And so Sanvello is very focused on creating outcomes, not just an experience, but improvement of symptoms. Because we truly believe that if people don't start getting better and staying better, the access problem is only going to worsen. It's not like we're creating new providers overnight. And so simply putting brick and mortar in the cloud will not address the access problem. But I think also, as we've seen with this pandemic, that consumerism, people are going to choose the solutions that they want to involve in their own healthcare. And so if they don't see value in that experience and actually getting outcomes, I think they will stop accessing that care over time. And so for us, we have a huge focus on access, as you said. So that's why we choose to use coaches in addition to teletherapy, because we think that that collaboration will allow the teletherapist to work at the top of their license. The coaching can make sure that they actually implement all of the techniques and the tips that the therapist is giving them during the week to maximize the value of therapy. And then also having self-care so that once they're done with therapy, all of those tools that were utilized continue to be within the app for them to use long term. So we really think that these tiers of care really can improve quality, improve outcomes, but also sustain the improvement, which is also something we frequently don't talk about in behavioral health.
Oh, that's really, really great perspective. Sarah, I'd love to get your thoughts. At Quartet, you work very closely with large enterprises, large health plans, provider groups. How do you think about this mix between access, and quality outcomes? Are they synonymous? Are they not synonymous? Are they two different things? How do you guys think about it?
Definitely two different things. I think that access is where a lot of people start, because if you're not in a venue to receive care, you certainly can't measure the quality of the care. But Quartet is definitely in the camp of quality is valuable. It's certainly something that we talk about all the time. How do we measure the quality of mental health care? What are the standard tools that we can use and that our providers can use? In the past year, we've implemented, I think, 10 assessments in our product to help start to measure a clinical baseline for our patients to try to measure the improvement over time. But in addition to that, we think about quality as more than just, are your numbers improving on an assessment? We think about, what was your experience like? Is it clear to you, like, where the office is? Was the person friendly? Do you feel a connection with your provider? And all of that goes into how we think about quality. So, more than any other relationship in your healthcare life, healthcare ecosystem for a person, the relationship with a mental health provider is one of the most important to feel connected, because a lot of it involves being very vulnerable, sharing, being completely transparent and honest, and you have to have a foundation of trust. So we're looking at it from the clinical perspective, but we're also marrying the user experience elements to really kind of paint a full picture of quality, if that makes sense.
It's very helpful. Arundhati, I don't know if you wanted to jump in and start with some questions.
Yes, I actually had a question for you, Dan. Samantha talked about integrating some of these solutions. So first of all, can you name any mental health startups in your portfolio? And then how do you see sort of the landscape? Do you see more consolidation? Are we going to see Teladoc Livongo kind of stories pop up? What's your crystal ball telling you?
I was going to say, how much time do we have here? So, behavioral, it's bittersweet for me. Behavioral health is an area that I've been focused on since 2016. Have written extensively about, the lack of adoption, from large enterprises. And we've only made one investment. I think we would have loved to have made more. But the one investment we've made is a company called WeHealth. It's still stealth, but it is a behavioral health platform focused on targeted conditions. So, to our earlier point, it's not a broad-based access platform. It's really focused on targeted conditions. And the first condition they're focused on is suicide and suicidal ideation. And so just kind of thinking about all of the barriers to adoption for care for this highest cost, seriously ill population, and why are they not receiving care today? And what do you have to, put around the patient and the healthcare ecosystem in order for the access care? And I think that's one of the things that I've learned, behavioral health specifically, but health tech broadly. The scientific problem, to me, oftentimes is not that complicated. It's the whole healthcare system. The healthcare system is what's wrong. How we reimburse for care, the fact that we have, a lack of access and a shortage of clinicians that are trained in a specific, kind of condition is oftentimes because we have not reimbursed. We have not, incentivized the healthcare system to care for those populations. And so, although it may be a patient who is a high utilizer of the healthcare system, they're always in the healthcare system, they may not be getting the care that they need. And so it's not just the software, it's not just the services, it's like a holistic approach. And so that's kind of how we've thought about it. But I think it's undeniable what's happening in the behavioral health tech space. In 2016, I was crying, why don't we have more adoption? Why don't we have more investment in the space. In 2020, I might argue that it's quite buzzy. It's quite hypey right now. There's so much excitement around this space, a lot of dollars coming in. And, again, hard for me to say that's a bad thing, right? But again, I go back to what I said earlier. I still don't know that we have enough people talking about outcomes. Candidly, I don't know that we're actually paying for outcomes today. You can have a best of breed solution, but if another solution, again, has a better look and feel, a better experience, that may get more utilization, right? And I think consumers are going to vote with their feet, and large organizations will pay for engagement today. So, I think it's complicated, but I think all of the excitement that we have around the behavioral health space is a great thing. I think, as we all talked about it, the stigma, I think there still is stigma on behavioral health and people with behavioral health conditions, but I think that stigma is decreasing. I think that's one positive, silver lining of the pandemic, is that everybody's dealing with these challenges that many people dealt with before. And you have a lot of celebrities, you have a lot of professional athletes being open and candid about the struggles that they're having with behavioral health, and people being more open about people in their own families. I think everybody has a first-degree relative who has struggled with behavioral health conditions. And the more that we can talk about it, the more that we can normalize it, I think the better for our society.
Makes sense. Thanks very much, Dan. We do have a question from the audience. I'll direct it first to Sarah, and then maybe Dr. Roots, you can also address it. How are you training these telehealth coaches? Sarah.
Treating, meaning what?
Training. I'm sorry.
Oh, training. Okay.
Yes.
Oh, sorry. So we have a team of people at Quartet. We call them the mental health provider liaisons, I believe is their full long title. But they work directly with the mental health providers they have relationships with. And so when COVID started, and we basically did an education campaign around here are your choices for teleplatforms that you can use, walk them through the setup if they needed it, put some material out through email, a webinar. So really tried to offer support in whatever way the mental health provider was looking. Most of them, though, quickly adopted it on their own, and a lot of these technologies and tools are pretty simple and straightforward and relatively easy to implement, like the Doxy and some of the others. So we offered support, but a lot of our MHPs just didn't even need it.
Okay. Dr. Roots.
Yeah, at Sanvello, we actually have our own video conferencing technology, as well as our own app and messaging interface. And so for us, we select coaches, if you want to call them that, and teletherapists and telepsychiatrists. They have to go through a 3-4 week intensive training for us. And what we look for is not just, can you use the technology, but how's your eye contact? How is the lighting? How is your engagement with individuals? How do you understand our experience, and how do you collaborate? And so we want that experience for that user to be the best possible, and also get those outcomes. And so for us, we actually don't even allow someone to interact with the user until they can pass some mock sessions, which frequently we don't see in brick and mortar, right? So we really do try to set a very high bar. And I think the reason that we do that is what I was saying before, that we truly believe that outcomes is not just based on the symptom improvement, but your experience. Because if the experience is not good, you won't engage in the therapy and actually improve.
I mean, I think it goes back to what, Dan, you were talking about, are people still paying for outcomes, and we're not there yet. I kind of feel that in many cases, large employers feel like they want to show that they're doing something. And so they bring on different kinds of solutions, and then we don't really see what the engagement is. But then they can't take it away either, because it's a service that they're providing. So when do we move from pat yourself on the back that I'm providing a service to actually seeing the results? I think that's interesting. So I'm going to encourage the audience to add some questions in the chat. Meanwhile, one question I had, and this is maybe for Samantha. I mean, I heard all of you talk very deeply about connections. In my own life, I mean, I fortunately have not struggled with mental health my brother, the only other sibling I had, my older brother, he died of cancer 3 years ago. My parents are still alive. And I still remember going on a walk with him around his apartment in San Jose, California. And he asked me whether my parents would be able to take it, the fact that they're gone. At that moment, I choked up and I didn't even answer the question. I was like, I won't be able to take it. But I did convey this to my parents, and they found purpose in that sentence, that the fact that he expected them to carry on and not break down because their firstborn is gone, that gave them purpose. So I'm wondering, beyond community and connections, isn't there purpose that we need to find to be able to rise to these sort of mental health challenges? Or maybe I'm simplifying it, so you correct me here.
Oh, no, I will jump in and invite my other panel members to help. But first of all, I'm sorry for your loss. That's a tragedy. That sense of purpose is interesting. And as a senior leader in a large health system, you don't have to look far to find purpose every day, particularly when our health system was caring for a disproportionate number of the COVID positive patients in the state of Minnesota. There was clear purpose. That purpose can also act as a mask to subjugating or reducing the priority of one's self-care. And left to fester, that can show up differently later on, or even in relatively crisis situations, that our ability to be resilient, to respond to change, certainly is lessened. So I would purpose is important. It provides meaning. It gives us a reason to move forward. It gives us a reason to do what we need to do today. And being very intentional in not allowing that purpose to be a mask around self-care. But I certainly would invite Monika or Sarah to jump in as well.
So a purpose-driven life is something that everybody wants, right? And I think about purpose as a goal, right? So what is that infinite goal that you want to reach? And so that takes a lot of introspection, right? And takes a lot of journaling, and how am I going to get there? And how are we going to do those small steps to achieve that purpose, that goal that you're trying to reach? But I think we also need to acknowledge that not everybody can make those steps. Some people are stuck. And mental health symptoms frequently get a person to be stuck in that difficulty. It's not that they don't have a purpose. It's just difficult to kind of lift their foot and make that first step there. So I think that that's why teletherapy is so important, making those connections, understanding what that purpose is and what might be keeping you from getting that next step is really important. So I think that purpose is definitely there, but acknowledging where you're at is also extremely important, in getting those supports around you.
Very well said, Monika. Sarah?
Yeah, that was really well said, Monika. Yeah, I agree. Purpose is key to making people feel fulfilled. It is closely linked to your personal identity, not feeling that you have a clear identity, or who am I? What am I doing here? All of those are questions that people ask themselves, but for some people it really plagues them. And a lack of purpose, a lack of identity, a lack of a path forward can feel crippling or debilitating to some people. So like Monika said, it's a lot about introspection through either on your own, solitude, coaching, therapy, just a partner to help think through those big questions that we all ask ourselves. And then for us as people, like, who can we support in that way in our lives? If it's people that report to us, if it's siblings, if it's friends, just trying to really come together as a country or a world, and try to make people a little less lonely and a little more fulfilled.
So we're coming up on 60 minutes. I just wanted to take one last chance and very briefly ask each of you about your challenges and opportunities in 2021 for mental health. So Dan, I'm going to start with you.
Yeah, no, it's a really great question. Again, just kind of piggybacking on the conversation that we just talked about purpose, where my mind went was, oftentimes I think, people who are designing solutions, investing in solutions, we want to be evidence-based. We want to be thoughtful about, the market opportunity, the market size, and we spend a lot of time, effort, energy, and capital in designing these like world-class solutions. But I think rarely do we actually ask the patients, what do you want? What do you need? We talk about this kind of user-centered design, but in practice, I don't know that it actually happens. And I think oftentimes, as investors, again, we see a lot of really spirited entrepreneurs building these like great products. But oftentimes what we want to look for is like, well, what happens when the patients use it? How do they use it? Do they use it? And so again, another story I'll tell is, in 2016, we looked at a very, very early stage company called Talkspace that had, thousands of users at the time, a few $1 million, in recurring revenue. And they came to market with this text message based therapy. At the time, at a fund that has a lot of doctors as, clinicians on the investment team, we were skeptical. And we talked to all the psychiatrists and we looked at, is digital CBT as good as in-person CBT? Where are the studies? And, I don't think we got a great answer. We kind of went back and forth. We struggled. We ended up not making the investment. I think we were looking at the wrong thing, right? To Monika's earlier point, were patients using it? And you could see that patients were using it over and over again. We were asking the wrong question. And so that is now a filter as I think about, going forward in behavioral health. I don't think it's enough to just look at the evidence and say, well, this is how patients should react and should behave. Look at how they use it. Look at their experience, understand that, and then, use that and use that to build better market adopted solutions.
Great. Sarah?
I love that. Do they use it? Yes, it's so interesting. A lot of the time at Quartet, we focused on the providers. We focused on building products for PCPs, MHPs, and we have a patient-facing product, but the focus for the first couple of years was really on building up our provider adoption. And the more that we've invested in the patient product in the last 16 months, the more adoption we see. And it is just so interesting to see the patients coming back and coming back and coming back, because what they want, as we're all talking about here today, is connection. And they're finding that with our Quartet's care navigators and with the providers, of course. So I think building on that, really continuing to build out a long, supportive relationship with our patient base, so that as they go through their life and the inevitable struggles they're going to face and then reface and then reface and then reface through the course of life's up and down, that we can be a trusted partner to them. So I think that's going to be our mission for 2021. Love it.
Monika?
So what I see in 2021, which we're kind of seeing now, is a behavioral pandemic. And it's not going to be just national, it's going to be global. And so for us, given we are a global company, we continue to think about how can we scale, how can we reach that need, and how can we do it well. And so for us, we continue to scale, but look at outcomes, engagement, experience, because we truly believe that if people have these skills, we can reach not just remission, meaning feel better, but trying to actually keep people there. So for me, as we think about these scale and numbers of people who are going to come forward and raise their hand and say, I have a mental health condition, we have to be ready for that, in some ways, tsunami of individuals who are going to be raising their hand asking for help.
Samantha?
I think as an employer, speaking for large employers, what Monika, Sarah, and Dan have said is very important, and that is providing solutions that can grow and change as the needs of the individuals do. And as tired as the audience and the panel may be around accessibility, it's still a very real barrier to care. And it can be physical, but then it also can be emotional. And as we've talked about pretty well today, it's that creating a space where people can acknowledge that they need help, and then being connected to resources and individuals who can do that. Thank you for the conversation today.
Thank you to each and every one of you. I thought it was a wonderful conversation, so much to learn. I almost feel someone put in the chat that these ideas should be incorporated in the classroom. We should equip our kids to, to deal with some of these issues. Again, thank you very much. I know there are tons of virtual events out there, so I appreciate all of you who came to attend, and of course, the entire panel.